You're looking to get smart, fast, on important health topics, right? Well, you've come to the right place. Today on the deep dive, we're zeroing in on disorders of the male reproductive system.
Exactly. Think of this as your shortcut to understanding a whole range of conditions.
Yeah, everything's from structural quirks you might not even know about, right? To
Mhm.
infections and, well, the more serious concerns too.
That's it. We've, sifted through a stack of medical, surgical, nursing materials.
To bring out the crucial details.
Yep, clearly and concisely. We'll hit the key signs, symptoms, and treatments.
Okay, let's unpack this. Let's start with some of the structural variations.
Mhm.
First up, cryptorchidism. What exactly is that?
So simply put, it's when one or maybe both tests haven't made their way down into the scrotum before birth.
Right.
They might be sort of hanging out in the inguinal canal or even still up in the abdominal cavity.
Right, and it's interesting, the sources point out the cause isn't really known.
Yeah, that's true.
So if this is happening, what does it mean for someone's health, down the line?
Well, there are a couple of key things to be aware of. Firstly, it can affect sperm production
Okay.
and therefore fertility. Secondly, and this is a really significant point, it increases the risk of testicular cancer later in life.
Wow, okay. That's major.
It is. While it's hard to put an exact number on it without more specific data, it's a well-established link.
So it's more than just a physical difference. What can actually be done about it?
Well, in some instances, androgen therapy might be used, but often the treatment involves a surgical procedure. It's called orchiopexy.
Borgiobacy.
Yeah, to physically bring the testes down into the scrotum.
Now, one of the things our sources address directly is this idea that cryptorchidism means painful swelling of the scrotum. But that's false, right?
Precisely. That's completely false. The hallmark of cryptorchidism is actually an empty scrotum.
Because the testes aren't there.
Exactly. They haven't descended. Painful swelling isn't really a characteristic symptom of this condition.
Got it. Okay, let's move on to something that definitely sounds painful. Torsion of the spermatic cord. What happens there?
Ah, yeah. This is a situation where the spermatic cord, the one that supplies blood to the testicle, it twists.
Twists, like kinks.
Yeah, imagine a kink in a garden hose. The blood flow to the testicle gets cut off, and this, I have to stress, is a medical emergency.
Right. Immediate attention needed.
Mm.
What might make someone more susceptible?
Sometimes it's due to a congenital issue, like the spermatic cords aren't as securely attached as they should be, maybe.
Okay. And the symptoms. What would someone actually experience?
The onset is usually sudden and severe.
Okay.
Think sharp, really intense pain in the testicle along with local swelling.
Hmm.
You might also get nausea, vomiting, maybe chills, even a fever.
Wow.
It's your body's way of, signaling a serious problem.
That sounds incredibly concerning.
Yeah.
And the source material is clear.
Yeah.
Immediate surgery is needed.
Hmm.
That really emphasizes the urgency.
Absolutely. Time is critical. The quicker the blood flow is restored, the better the chance of saving the testicle.
Okay, next up we have phimosis and paraphimosis. These relate to the foreskin, right? In uncircumcised males.
That's correct. Phimosis is when the opening of the foreskin is too tight. It can't be easily pulled back over the head of the penis, the glands.
And paraphimosis.
That's when the foreskin has been retracted, but then it gets stuck back there. It can't be returned to its normal position, and that causes painful swelling.
Ouch. So what are some of the signs someone might notice?
Well, you might experience pain during erections, maybe during intercourse. Difficulty keeping the area clean is another one.
Mm.
In more severe cases of paraphimosis, you can see significant painful swelling of the glands, fluid buildup, edema, and potentially even difficulty urinating.
And how are these conditions typically managed?
Treatment can range a bit. Sometimes it's focusing on careful hygiene practices, especially in milder cases of phimosis,
Right.
or it might involve circumcision to, widen the foreskin opening. For paraphimosis, though, prompt medical intervention is needed.
To reduce the swelling.
Exactly, and return the foreskin to its normal position. Sometimes that might even require a small surgical procedure if manual reduction doesn't work.
Okay. Now we have a trio of conditions that can all present with swelling of the scrotum.
Yeah.
Hydrocele, spermatocele, and varicocele. How do you tell these apart, and what does it mean for treatment?
Right, let's break them down. A hydrocele is basically a collection of fluid in the sac around the testicle.
Okay, fluid.
A spermatocele is a cyst. It develops in the epididymis, that's the coiled tube at the back of the testicle where sperm matures, and it contains sperm.
A cyst with sperm. Got it.
And then a varicocele is different again. It's essentially an enlargement of the veins within the scrotum, kind of like varicose veins you might see in legs.
Ah, okay.
Now, for the person experiencing it, the key difference often lies in whether treatment is needed. Hydroceles and spermatoceles often don't require any treatment.
Just watch and wait.
Pretty much, yeah. Might just be monitored over time.
But varicocele is different.
Yes. While some men with varicocele have no problems, they can be a contributing factor to male infertility.
Ah, infertility.
Right. So they might need surgical repair if that's an issue, or if they're causing discomfort.
Okay, so scrotal swelling isn't always an emergency, like portion, but definitely something to get checked out by a doctor if you notice it.
Absolutely. Always best to get it evaluated.
Now, our sources also briefly cover testicular self-examination, TSE. Even without diving into a detailed table, what are the essential steps people should know?
Yeah, it's important. The basic technique involves gently feeling each testicle with both hands.
Both hands.
Yes. Use your thumb and forefingers to gently roll the testicle between them. You're feeling for any hard lumps or, irregularities, anything that feels different.
Okay.
It's also important to locate and gently feel the epididymis. It feels like a soft, sort of tube-like structure on the back of each testicle.
And doing this regularly helps.
Exactly. Regular self-exams help you become familiar with what's normal for you. That makes it much easier to detect any changes early on.
That makes good sense. Okay, let's shift gears now. Infections and inflammatory conditions. Starting with prostatitis. What's going on there?
Prostatitis is simply inflammation of the prostate gland.
Inflammation. Okay.
What's interesting is that it can have several different causes. It's not just one thing.
Right. Our sources mention bacterial infections like E. coli, microbes that cause SPIs, and even non-bacterial factors.
That's right. It's quite a wide range. Sometimes it can even be related to psychosexual issues, though that's less common.
So it's complex. What about the symptoms? What might someone experience?
Well, symptoms can vary too. They can include swelling and tenderness of the prostate gland itself, which might be felt during an exam.
Okay.
Also, pain in the perineum, that's the area between the scrotum and anus. Sometimes unusual sensations before or after ejaculation. Lower back pain is common too.
And maybe fever. Difficulty urinating.
Yes, fever, pain, or difficulty urinating, sometimes even a discharge from the urethra.
So the idea that prostatitis has multiple origins is definitely true then.
Absolutely supported by the information.
And in terms of what can be done, treatment.
Treatment typically involves antibiotics if a bacterial infection is suspected or confirmed.
Makes sense.
You might also be prescribed pain relievers, analgesics, and sometimes sitz baths can provide some relief.
Okay. Next up, epididymitis and orchitis. These often seem to be mentioned together. How are they related?
Good question. They are related because epididymitis, that's inflammation of the epididymis, and orchitis, inflammation of the testicle itself, can happen at the same time.
Ah,
Or epididymitis can occur on its own. It might affect one side or both sides.
and what could trigger these inflammations?
Similar to prostatitis, infections are a common cause, often spreading from maybe a prostate infection or another infection in the urinary tract.
Right.
But there's also non-infectious epididymitis that can sometimes be linked to things like long-term indwelling catheters or maybe certain medical procedures involving the genitourinary system.
And orchitis specifically.
Orchitis can be caused by the mumps virus, particularly if you get mumps after puberty. That's a key one to remember.
Mumps. Okay. What are the telltale signs someone might experience with either of these?
You'd likely notice pain and swelling in the groin area and scrotum, often accompanied by a fever and chills. Pretty clear signs something's wrong.
And the treatments.
Yeah.
Sounds like they aim for relief in fixing the cause.
Exactly. Things like bed rest, elevating the scrotum to help reduce swelling, applying cold packs locally.
Okay.
Pain and anti-inflammatory meds are usually given, antibiotics if there's an infection, and in some rare, chronic, severe cases of epididymitis, a surgery called epididymectomy might be considered.
Okay, all right. Let's switch gears again.
Yeah.
Let's talk about erection disorders, starting with erectile dysfunction or ED. Physiologically, what's happening?
Okay, ED. Essentially, for an erection to happen and be maintained, several things need to work just right. You need proper nerve signals, sufficient arterial blood flow into the penis, and then the ability to sort of trap that venous blood in the penis to maintain firmness.
A complex process.
It is. Erectile dysfunction occurs when there's a breakdown somewhere in that process. Could be the nerves, the blood flow in, or the blood flow out.
And the sources indicate causes can be physical and psychological, right? It's not always just one thing.
That's a really important point. Absolutely. Your mental and emotional state, things like anxiety, stress, depression, can definitely play a big role.
Yeah.
But so can underlying physical health conditions. Think diabetes, heart disease, high blood pressure, neurological disorders, even side effects from certain medications.
So a lot of potential factors.
Hmm.
What are the main signs someone might notice if they think they have ED?
Well, the primary indicators are pretty straightforward. It's consistent difficulty in achieving an erection firm enough for sex, or difficulty maintaining an erection long enough.
Difficulty and insufficiency.
Exactly. Insufficient rigidity is another way to put it.
And how might ED be diagnosed?
There are a few tests that can help figure out the underlying cause. Things like nocturnal penile tumescence and rigidity tests, basically monitoring erections during sleep. Okay. And vascular ultrasound studies can be used to assess the blood flow to the penis. Plus, a good medical history and physical exam are crucial.
And the management approaches sound quite varied depending on the cause.
Absolutely. Very much depends on the cause. Treatment might involve changes to medications if they're contributing.
Right.
Various drug therapies exist, the pills everyone knows about, but also injections or suppositories. Then there are treatments focused on achieving penile engorgement, like vacuum devices.
Okay.
In some cases, vascular surgery might be an option. And then there are penile implants for more severe, persistent cases.
Now, priapism is another erection disorder, but it sounds quite different and potentially more serious.
It is, yes. Priapism is a persistent erection. The key difference is it occurs without sexual stimulation.
Oh, okay.
And unlike a normal erection, it often doesn't go away on its own. And it can be quite painful.
What could cause something like that?
Potential causes include vascular problems, certain underlying medical conditions like sickle cell disease, leukemia, and also side effects from some medications, including some used for ED, ironically.
The symptoms sound alarming.
They are. I mean, besides the discomfort or pain, a prolonged erection like this can actually interfere with normal blood flow to the penis tissue.
Damage the tissue.
Yes, there's a significant risk of tissue damage, ischemia if it's not treated promptly. It can also make it difficult to urinate.
So treatment needs to be swift.
Yes, it's considered a urologic emergency. Treatments can include injecting vasoconstrictive medications directly into the penis to help reduce blood flow,
Okay.
draining the trapped blood, aspiration. And in some cases, surgery might be needed to create a shunt.
Wow. And emotional support must be key too.
Definitely. It can be a very distressing and frightening experience.
Let's move on to benign prostatic hyperplasia, BPH. This affects many older men, right? So it's important to be aware of.
That's right. BPH is very common. It's characterized by an increase in the number of cells in the prostate gland. It's hyperplasia, not hypertrophy.
More cells, not bigger cells.
Exactly. And this enlargement of the prostate can then lead to a narrowing of the urethra, the tube that carries urine from the bladder, because it passes right through the prostate.
Right. And the symptoms tend to creep up gradually.
Yes, usually. It's often a slow process. People might notice increasing difficulty with urination.
Like what specifically?
Trouble starting a urine stream, maybe a weak or interrupted stream, a feeling that you haven't completely emptied your bladder.
That lingering feeling.
Yeah. And needing to urinate more frequently, especially at night, that's nocturia. And sometimes a sudden, urgent need to go.
How is BPH usually diagnosed?
Several tests can be used. A digital rectal exam, or DRE, is common that the doctor feels the prostate size and shape.
Okay.
A cystoscopy might be done that involves inserting a small camera into the urethra and bladder. Maybe an intravenous pyelogram, IVP, which uses X-rays to look at the urinary tract.
Blood tests too.
Yes, blood chemistry tests, including a PSA test, prostate-specific antigen. Although PSA can be elevated in BPH, it's also used for cancer screening, so that needs context. And a transrectal ultrasound of the prostate is often done. Sometimes a biopsy might be needed to rule out cancer.
And the ways to manage BPH? Seems like there's a range.
There is. If symptoms are mild, the doctor might just recommend watchful waiting, regular checkups.
Keep an eye on it.
Right. Then there are various medications. Some help shrink the prostate, others relax the muscles around the urethra to improve flow.
Mhm.
Some men explore alternative therapies too, like saw palmetto, though evidence varies. And if symptoms are more bothersome or there are complications, surgical procedures might be options.
Like TURP.
Yes, TURP, transurethral resection of the prostate, is a common one, but there are others too, like 2UIP, 2LIP, 2UNA, and sometimes a full prostatectomy, though that's less common just for BPH now.
Okay, now we turn to malignancies. And first up, prostate cancer. What are some risk factors?
Well, our sources point to a few things that might elevate risk. Increased levels of testosterone over a lifetime, potentially. A diet high in fat.
Diet again?
Yeah. And having a family history of prostate cancer is a significant risk factor.
And the location of the tumor matters for symptoms.
Yes. Prostate cancer often starts in the outer part of the gland, the peripheral zone. Because of that, in the early stages, you might not have any noticeable urinary symptoms at all.
So it can be silent early on.
Very much so. However, as the cancer grows, it can cause local symptoms related to urination, similar sometimes to BPH, but also symptoms that indicate the cancer has spread, metastasized.
What kind of local symptoms?
Hmm.
And what suggests spread?
Locally, you might notice more frequent urination, especially at night, difficulty starting or stopping, maybe blood in the urine or semen that's hematuria or hemospermia. Erectile dysfunction can also occur.
Okay.
If the cancer has spread, often to the bones, you might experience persistent back pain, hip pain, or leg pain. Those are important warning signs of metastatic disease.
And how is prostate cancer diagnosed then?
Key findings would include an abnormal DRE, like a hard nodule on the prostate. An elevated PSA level is a major indicator, though not definitive on its own.
Right, the PSA test.
Then, a transrectal ultrasound with biopsy is usually needed to confirm the diagnosis. Imaging studies like X-rays, MRI, CT scans, bone scans, and maybe an IVP can help determine the extent or stage of the cancer. An elevated serum acid phosphatase level can also sometimes indicate spread.
Screening is really important here.
Yeah.
What are the current recommendations?
Okay, screening. Generally, for men with average risk and a life expectancy of at least 10 years, annual screening with a PSA test and a DRE is recommended starting at age 50.
Age 50 for average risk.
Yes. However, for higher risk groups, that includes African American men and men with a first-degree relative, father, brother, son, diagnosed before age 65, screening should begin earlier at age 45.
45 for higher risk. So the idea that screening starts at 60 for everyone is definitely wrong.
Yes, that's incorrect according to these guidelines. It's risk stratified and starts earlier for many.
Got it. And the treatment options for prostate cancer seem quite diverse.
They really are. It depends heavily on the stage and grade of the cancer, the man's age and overall health, and personal preferences too.
Options like?
Well, for very early, slow-growing cancers, sometimes active surveillance or watchful waiting is an option, carefully monitoring it.
Okay.
Surgical options include radical prostatectomy, removing the whole prostate. That can be done in different ways, like suprapubic or retropubic. Sometimes, in advanced cases, bilateral orchidectomy removal of both testicles to cut off testosterone might be done.
Radiation.
Yes, radiation therapy is a major treatment, either external beam or brachytherapy, which involves implanting radioactive seeds. Hormone therapy is also key, especially for advanced cancer.
How does that work?
It aims to lower testosterone levels using anti-androgenic drugs or sometimes estrogenic drugs, but these can have significant side effects like hot flashes, loss of libido, and feminizing effect.
Right. Other options.
Cryotherapy freezing the prostate tissue is another possibility. Immunotherapy is emerging. Often, treatments are combined.
Okay. Next, let's talk about testicular cancer. Our sources immediately highlight a big risk factor.
Yes, absolutely. Having a history of cryptorchidism, those undescended testicles we talked about earlier, is a major risk factor for developing testicular cancer later.
That link is strong. Are there other potential causes?
It's thought that maybe early problems with cell development in those undescended tests or other abnormal cellular changes might play a role. We classify testicular tumors generally as either seminomas or non-seminomas.
And that affects treatment.
Yes, the type influences the treatment plan and prognosis.
What are the key signs and symptoms someone might notice?
The most common sign by far is swelling in the scrotum or finding a lump or hardness in one of the testicles. Often it's painless.
Painless lump. Okay.
Sometimes there might be a dull ache or heaviness in the lower abdomen or scrotum. Less commonly, acute pain. Some men might notice breast tenderness or growth due to hormone changes caused by certain tumor types. General weakness or abdominal pain could indicate spread.
And how is it diagnosed?
Diagnostic tools include blood tests for specific tumor markers like AFP, HCG, and LDH. Ultrasound of the scrotum is usually the first imaging test. Then CT scans of the abdomen, pelvis, and chest, and maybe MRI are used to check for any spread. IVP or lymphangiography might sometimes be used too.
And the treatment approaches are tailored to the stage.
Very much so. Treatment depends heavily on the type of tumor and how far it has spread.
What does treatment typically involve?
Surgery is almost always the first step. That usually means a radical inguinal orchiectomy, removing the entire affected testicle and spermatic cord through an incision in the groin, not the scrotum. Depending on the stage and type, further treatment might include chemotherapy, radiation therapy, or sometimes a further surgery called a radical retroperitoneal lymph node dissection to remove lymph nodes where the cancer might spread.
Fertility is a concern here too, isn't it?
Yes, absolutely. Sperm banking before starting treatment is really important for men who might want to have children later, as treatments like chemotherapy and radiation can affect fertility. Autologous bone marrow transplantation is sometimes used for advanced or recurrent disease.
Okay. Finally, in terms of male reproductive cancers, penile cancer. It's rare.
That's correct. It is relatively rare, particularly in places where circumcision is common. It tends to be seen more often in uncircumcised men.
And how does it usually develop?
It's often thought to develop over time, maybe starting with chronic irritation, possibly related to phimosis or poor hygiene. Then potentially a precancerous skin lesion might form, like carcinoma in situ, and eventually it can progress to invasive malignancy. HPV infection is also a risk factor.
How is it diagnosed?
Diagnosis usually requires a biopsy of any suspicious lesion on the penis. Imaging studies like CT and MRI might be used to see if the cancer has spread locally or to lymph nodes.
And treatment options.
Treatment can range depending on the stage. For very early stage cancers, options might include topical chemotherapy, laser ablation, or local excision.
Okay.
For more invasive tumors, wider surgical excision or even partial or total amputation of the penis penectomy might be necessary. Chemotherapy and radiation therapy, either external or internal brachytherapy, might also be used, sometimes in combination with surgery. Lymph node dissection might also be needed.
Right. Okay, let's wrap things up with elective sterilization, specifically vasectomy. What exactly does this involve?
So a vasectomy is a relatively minor surgical procedure. It's done for permanent sterilization.
How does it work?
Basically, the vas deferens, those are the tubes that carry sperm from the testicles up towards the urethra, are cut, tied, cauterized, or otherwise sealed off.
So it interrupts sperm transport.
Precisely. It prevents sperm from getting into the semen that's ejaculated.
So it's a permanent method of birth control. And importantly, our source emphasizes what? No effect on.
Right. It's crucial to understand that a vasectomy only affects the transport of sperm. It has absolutely no impact on a man's ability to achieve an erection, his sex drive, testosterone production, or the sensation of ejaculation. The fluid ejaculated just won't contain sperm.
That's a key point. And the post-op care.
Yeah.
Pretty straightforward.
Yes, generally. It mainly involves some rest, ice packs to reduce swelling, avoiding strenuous activity for a short period, and importantly, understanding that it's not effective immediately.
Right. Need follow-up.
Yes. You need to use other contraception until follow-up semen analyses confirm that there are no sperm present. That can take several weeks or months and multiple ejaculations.
Okay. Well, you've really gained a comprehensive overview in this deep dive. We've covered a lot on disorders of the male reproductive system.
We certainly have. It's quite a spectrum, isn't it? From things like structural variations present at birth, like cryptorchidism, to infections, inflammatory processes like prostatitis or epididymitis, issues with erections, BPH, and then the various cancers.
It really is a broad range, and I think a key insight, perhaps, is how even seemingly minor or asymptomatic conditions early on, like that undescended testicle,
Exactly. Cryptorchidism.
can have significant long-term health implications, like the increased cancer risk.
Yeah,
It really highlights the importance of regular checkups and just being aware of your own body.
absolutely. And similarly, the urgent nature of conditions like testicular torsion, that sudden severe pain, it really underscores how vital it is to seek immediate medical attention for certain symptoms. You can't wait on something like that.
Definitely not. So by exploring these medical surgical nursing materials, hopefully our listeners now have a solid foundational understanding of these topics.
Yeah, good baseline.
Of course, this information isn't a substitute for personalized medical advice. Always consult with a healthcare professional if you have any specific concerns. That goes without saying, really.
That's the most important takeaway. This deep dive is for educational purposes, based on the sources we've looked at. Always, always talk to your doctor or qualified provider about any health issues you might be experiencing.
So thinking about everything we've discussed today, the structural issues, infections, BPH, the cancers, what do you think is the single most significant factor for individuals to keep in mind for maintaining their reproductive health?
That's a tough one.
It's definitely something to consider. Until our next deep dive.